Are you one of the 49 million Americans that is currently taking a psychiatric medication? These medications are antidepressants, sedatives, amphetamines, and anti-convulsants. Well, if so, a 2015 study that examined the FDA's required preclinical trials for these medications found that many of them, and most of them, the majority of them, increased cancer risk in rodents in these studies. And although we can't say because it causes the increased cancer risk in rodents that it automatically will cause it in humans, we also haven't had the studies done on humans, and lack of evidence is not evidence of lack. So we should be prudent in our use of these, and at the very least, you should receive the informed consent that taking this medication may increase your cancer risk. Let's dive into which drugs specifically were found to increase the cancer risk. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. So if you look at your psychiatric drugs package insert, these findings will be listed on the insert. So this study in the Australian and New Zealand Journal of Psychiatry is what studied the insert results and studied the FDA required preclinical trials to be done on these drugs before they can be passed. So this knowledge has been known, at least by the FDA, all along. So what drugs showed increased risk of cancer or carcinogenicity in these studies? Many of them. 63% of antidepressant drugs showed increased carcinogenicity. The ones that were included are sertraline, which is also known as Zoloft, citalopram, which brand name is Celexa, escitalopram, brand name Lexapro, duloxetine, brand name Cymbalta, and bupropion, brand named Wellbutrin. So those drugs showed increased cancer risk in these studies. From a benzodiazepine perspective, Klonopin or clonazepam showed increased cancer risk. Zolpidem, brand named Ambien, diazepam or brand name Valium, and esopiclone, Lunesta. So if you're taking these for anxiety or for insomnia, there's the risk that they're increasing your cancer risk. The amphetamine methylphenidate or Concerta was shown to increase cancer risk. So if you're taking that for focus or for ADHD, be aware. And then lastly, 85% of anti-convulsants were shown to increase cancer risk. The only one that doesn't increase cancer risk per the studies was lamotrigine, brand name Lamictal. So if you're taking these for seizure issues, the lamotrigine is the best one in terms of lowest cancer risk. Gabapentin, brand name Neurontin, and pregabalin and brand name Lyrica both showed increased cancer risk. And then 90% of antipsychotics were associated with increased carcinogenicity. So the only one that wasn't was clozapine. So if you're on any other antipsychotic besides that, you have an increased risk of carcinogenicity from that medication. So again, the study brought this to light that just because it's found in rodents doesn't mean it's going to translate to humans, but because we don't have the studies on humans, we can't say that it's not going to happen. And why haven't the studies been done? Well, think about it. 49 million Americans are on these medications, meaning these are massive money makers. If we did a human trial and found that they were indeed causing cancer in humans, then that would be a lot of lawsuits, a lot of money lost, and a big economic hit. So instead of waiting for studies that are probably never going to happen, we should be prudent, and at least patients should receive proper informed consent so they know the risks of the medications and they can weigh the benefits and the risks and make an informed decision. So if you're on these medications and you don't want to be on them following this information, Well, then one thing you could do is have the conversation with your medical doctor and say, what are alternatives that I could try to deal with my depression or my lack of focus and attention or my anxiety or insomnia? They should be able to give you informed consent, which includes alternatives to the medication or other options. And one of those other options is functional medicine and getting to the bottom or to the cause of what's driving your depression or driving your insomnia or driving your anxiety. The cause is always the best thing to address. The medication is the Band-Aid. The cause is the answer. So if you're looking to address cause, seek out a functional medicine practitioner near you and strive for that life at optimal.